So thank you very much for this opportunity. I think it's very nice to try to have the opportunity to present what we do in Italy, and also to have also some comment and some suggestions. So I ask Anlo, you can go through the slide or without that, okay. So today the presentation is go to four simple resume of what we do in Italy: the initial situation, the mission and vision of the group, the creation of ePAG Italy, and the lesson that we learn of this experience. So the initial situation, it was the important point for us because we realized that in Italy we have more or less 180 ACP with 23 year-end presented in Italy in 24 year-end. So we are really a very good representative in year-end. And we have also 17 patient representative in Italy for different year-end. We are more personal, but representing 70 years. The important topic, it was really the integration of year-end that asked Eurordis and Board of Member States, the recommendation that they made, how we are able to make successful for year-end with the recommendation integration into the national health system. I think it's the key point for the success of year-end, really, because one thing is the European project suggestion, but if we are not able to include it in the normal practice, I think we don't achieve the goal. For this reason, we want to create this group in Italy of ePAGs because who can make this job? Who can involve and start to organize an integration with the national health system? I think it's the physician and the all expert are really the focus on research, on project to understand the disease, but not all are able to involve the national health system. For this reason, the ePAGs, it's important it works with the national alliance to join force and establish a national group of advocates and try to take some action for some activity with this goal to discover how we are able to make this integration in our state. So, starting from this point,
excuse me, Isabella, because there is like a background noise. I have unmute everyone, but I don't know what happened. I think it's because of the mobile phone sometimes, perhaps. So can you please try to mute yourself, perhaps? And
when you and Laura, when you are unmuting everyone, we get a question on the screen to unmute and mute yourself. So you're sending a message to us to unmute. What you're doing is not helping. So please, everyone.
Marina,
yeah.
Valenti, when you mute yourself.
Yeah, I think everyone is on mute now.
No, not Marina, not Marina.
Except...
She's not muted.
Yeah, I think almost everyone is on mute now. Okay, sorry about that.
No, thank you. It was, I don't understand where I'm coming. Okay. So the goal was working together with the National Alliance to support concrete action with the goal to do exactly try to do the integration. So we need to create a task force and thinking about what are the concrete action that we can make together. So for this reason, we define a mission and vision for this group. And the first topic was exactly this point: establish a national group of ePAG advocates with the main concrete activity group of patient representative that could contribute to integration of ERNs into the Italian health system. Our mission was really, at the beginning, very with a lot of topics, so we worked very hard, because one goal was the collaboration, so cooperate with Italian rare disease patients with different organizations, and integrate also the needs and the priorities at European level. Cooperate, it was really a very nice experience, because we are a group of a transversal group for different ePAGs, for different ERN. It was really a very value to share experience and join efforts and to reach crucial goals. Inform also the rare disease community, where they are able to find information about ERNs. Educate, it was organize educational activities. It was something that asking a lot our ePAG member, because they want to, we discovered that we have different skills, different level of information, and it was really the first need to try to have educational program to give the opportunity to have the same type of information. Contribute to the national decision and process. It was an important topic with the Italian Alliance. And advocate, it was another topic for improvement of the lives of rare and complex disease patients in Italy. It was not simple, because when we start a lot of topic, but how we are able to create this group in Italy is the topic. We start together I got, okay. The key point was that 3 of us meet together and promote the creation. We want to discover how it was able to create a group of ePAGs, because when we meet each other, the first topic was really very nice to share information, different point of view, different activities, how we can be effective for the ERN community, because involved is one topic, but to be able to have a concrete role in the ERN, I think it was something that we need to define together and to share the different experience. We ask in Eurordis and also the Italian Alliance to have the contact of the other ePAGs, and we start with the method how we can achieve the goal, to asking the other ePAGs if it was something, an opportunity to create this group, and if it was interesting to share this type of experience. And we start with the first methodology. It was the survey. We made a lot of survey to find out a solution how we can achieve democratic information and democratic decision in terms of the goal to create ePAGs group in Italy. And also a transparent process, because every decision, every single topic, it was decided by the majority of the ePAG involved. In the practical thing, we do 3 types of survey. The first one was to the information, who we are, which type of ERN, which is, or which are our background, which are the information that we have. The second one was to design an agreement, how we want to create and manage a group of patients. We establish rules that everyone needs to vote with different choices, to be sure that everyone understands the dynamic of this type of group. And the third survey, it was very important to have a curriculum for everyone, to understand also which type of experience we will have, to be sure that we have a mix of different skills, and also to evaluate who is the ePAG's more expert in some topic, to create really specific key point or key person to ask in some specific questions that we'll discover step by step. with this survey, we are able to understand the need of the ePAGs, to define together the mission of the group, and to have an idea which we are as ePAGs and for the future activity. So after this survey, we realized that we collecting 45 Italian ePAGs for different year ends. We are 17 year ends represented in our member. So a very also which is named a very different year ends with different skills. In the rules of the of our ePAG group, we defined to have an executive committee to manage all organization, and we vote 6 people for ePAGs plus 1 member of the Italian National Alliance. It was important for us, and we vote of this, to have 1 member that make a bridge between the needs of ePAGs and the Italian National Alliance, because we need to work together and to join the force and also define strategy together with the Alliance, because it was something that we need as patient, and we ask Uniamo, the Italian Alliance, to be part of the ePAGs, because it's the key point is really, as rare disease, we need really to work in the same way. So we are now 6 for different year end, as you see now the people. We have different experience and different skills, and it is very important for us because we have really a good good referent people with a different topic. I think it was really a very value for create this group of ePAGs representative. The main activity that we have, as I spoke before, we try to have 4 key topic area. One, it was information. For us, it was important to have a WhatsApp group for urgent topic, for some important questions. Now with COVID is very hot WhatsApp group with a lot of different information. Facebook page to share our experience and also to share some activity, to share congress or some meeting where there are ePAG involved, and also the website. I think the website was a key point for us, because I don't know how is the situation in the other country, but in Italy, nobody knows about year ends. Not only the small hospital, but also the patient, also the community. How we can achieve the goal to bring the people to understand the mechanism and the information about the year ends. But I come back after with this because I have a slide and I can explain. So the second topic was educational. This was something that in the beginning we wanted not to do, but in the end it was some important requests for ePAGs. We start to, in the beginning, the webinar was with a lot of topics together, and then at the end we discovered that it was really necessary to define some webinar for different area, because come different mix of questions. One come back with guideline, the other one with the registry, the other one with other requests. So we define, okay, stop with this mix of questions, and we started to define some webinars dedicated on some topic. Is specific webinar patient to patients with the background or the experience that everyone have, but with the goal specific to analyze the target of patient view. What is important for the patient, how they can improve commitment, or how they can have suggestions, but with a target to analyze and to, for example, protect the patient's activity. So it was an important topic for us. And but I will explain also what we do at the moment, and then we can I can present what we do and what is the successful of this type of meeting. We have also monthly meeting every third Monday, every month, we have a conference with some different topic. And it's also a moment to share some particular experience. And also dissemination. We have different participation to national and regional meetings, or for example, we do for Rare Disease Day a very great meeting in Pisa for with all ePAGs and all with all ERN involved with the different healthcare provider presented all together in Pisa. So it was an extraordinary meeting for me because it was not only for one ERN, but included all community for ERN in Italy. Okay. So I speak before the website. If you want to look, is www.epag-italian.it. It was very important because for me, the focus for a lot of requests of the ePAGs was, but this disease, which ERN is, in which ERN is this disease, or in which ERN is this hospital, the other one. So a lot of different questions, but we are not able to answer because only for our disease, but some other disease, it was unknown for us. So we decide to do a website that is starting really from the disease. You can click your disease. For your disease, you go through which is the ERN involved for your disease, and you know better than me that different diseases are covered by different ERN, not only one. And also for this one, which are the Italian hospital involved in this ERN, and also the ePAGs involved in the same ERN. So it is an important view how we can achieve the information that we want to have in the local level, so integration with Italian system. And every patient, every people that want to know more about that have also the official information about ERN, and also the website, the official website for the single ERN, but also which is the topic in Italy, or which are the healthcare provider in Italy, and which are the ePAG to ask information in Italy. So I think it's something important because it's really, ERN is a great, for me, view of how we can manage the rare disease. But if we are not able to achieve the goal to arrive to the patient with this information, I think something is wrong. So, and the website is, it have this goal to make a bridge between the patients and the ERN organization with all healthcare providers involved, and also ePAG representative involved. We finalized the website for Rare Disease Day, but after COVID-19, we are not able to disseminate. And now with the executive committee, we want to discover how we can disseminate this information with a press release or with some conference that we need to postpone on October or November, I hope, of this year. But okay, now it's ready and we can start to disseminate also the registry. No, the website, sorry. Webinar, I spoke before about webinar because we receive a lot of requests, a lot of information for the different topic. And we discovered the most important need at the moment was registry. It was last month a lot of requests about to understand ERN assessment for the new hospital, the new HAP. How's working the National Alliance to make integration of ERNs? Which are the activity that they do at the moment? Which are the skills and the topic or what they do at the moment to start with this process of integration? The development of new medicinal product is something that everyone asks a lot of information on that. Sure, the information about EMA, how EMA works, which is the process not only for development, new drugs, but also which is the legal process for the European Medicine Agency. And in this group, we have Loris Brunetta, this is involved also in EMA, and I think it's a very good experience that can teach us a little bit more about this topic. and also year events and the rules of ePAGs. After this experience, we start at the moment with the first two webinar, registry, and also the assessment of year end. Both was a great successful, but also in particular the assessment of year end was really very, very useful for the patients, because nobody tell us as patients how we are able to be involved, which is exactly our role. And when we speak together with different ePAGs, becomes different type of involvement, and it was not clear if it's mandatory, some inclusion, if it's not mandatory, if one people can ask something or cannot ask something. I think it was really important to understand the process and give the correct information to the patient to participate in a correct way in the meeting, because if they are involved without have a background how they can manage that, it was impossible for them to make some type of suggestion or some type of idea of what year ran. So I think we receive a lot of compliments on that. Sorry, I'm late, I need to go. So the lesson that I learned is that we learned all together, it was really willingness of collaboration among ePAGs involved the different year-end to decide to establish ePAG Italy, with establishment of the group via democratic process, identification of a framework of collaboration with a national alliance, collaboration and active engagement of the national alliance, and ensure the inclusion of member and non-member. One important topic that I forgot, we have a lot of ePAGs representative member of the National Alliance, but also not member for National Alliance. And how is the criteria for Eurord is the same for our group. We want to involve everyone in this group, independent of the alliance with the national group. Which are the future perspectives and challenges? For us, it was very important to be included in the national and regional specific working group on rare disease to address the request of year-ends, transversal working group to the national and regional healthcare policy and initiative. It's very important to be involved in the concrete process. For example, in Italy, we have a national health system, but also an autonomy regional health system. So we need to work in both sides, local level with region and also national level. Establish a closer collaboration with year-end coordinators and representative of a border member state. It is very, very important in Italian level again. So we have in touch in Pisa with the 3 coordinators in Italy of year-end, and also with the representative of the border member state is Domenica Taruscio. So we need to find out a method of collaboration, how we can driving together the integration of year-end in Italy. And I hope we can start to collaborate very soon after COVID situation. Inclusion of new appointed ePAG advocates and in ePAG Italy, it's a very important topic. And for this topic, we will ask the collaboration with Eurordis to suggest for the new ePAGs from becoming from Italy that exists this ePAG Italy group, and to suggest to ask information to us and to be involved in this community. Also very important is we ask more educational activity and regular information update on ear needs, because what we discovered, it was more comfortable for the ePAG to speak in the same language of some particular topic, and also to receive very general information from some topic, but specific on the patient point of view. Because guideline, registry, everything, there are a lot of people expert on that, but what is the rule of ePAG? To take care that the information for ePAGs are correct, the information to protect the patient, for example, for clinical trial, for the information to protect the patient, how is important to know and to respect privacy or what is necessary, how is important to collaborate in the specific area, but give also practical example how they can be more active in to represent the patient in this assembly or the meeting or working group. And also, I think it's something that we discovered is a key point for the successful of ePAG, because it's not only simple to involve the patient. We need to give them the tools, how they are able to make the difference in every working group where they are involved. And there is our great experience that we made in Italy, a lot of work, but also a lot of ePAG, very happy to have this opportunity to have a group of reference or a place where we can share every question, every suggestion, every single perspective that we will discover step by step. For example, now with COVID, we have a lot of active question and answer that improve everyone to become, in a simple way, a lot of new information. Thank you. Thank you very much.